All right, let's dive into the body's two main command centers, the nervous and endocrine systems. Today, we're going to look at what happens when these incredibly complex networks get pushed way past their limits and face a sudden life-or-death crisis. Think about it like this. Your nervous system is the body's super-fast internet. It zaps electrical signals everywhere for instant reactions. You know, like pulling your hand off a hot stove before you even register the pain. The endocrine system, though, that's more like the postal service. It sends out chemical messages, or hormones, through the bloodstream. It's slower, but it handles all the long-term stuff like growth and metabolism.
So, what happens when that internet connection just crashes, or the mail service starts delivering all the wrong packages to the wrong addresses? Well, the results can be absolutely catastrophic. And that's exactly what we're getting into today, the major crises that can bring these essential systems to a screeching halt.
We're going to start with the nervous system, and specifically, what happens when it takes a sudden physical hit. We're talking about those traumatic injuries that can disrupt the body's entire electrical grid in a split second. You know, when it comes to a spinal cord injury, everything boils down to two things: where it happened and how bad it is. Just imagine the spinal cord as the main information superhighway, running from the brain down to the rest of the body. Any damage is like a massive roadblock, and all communication to every point south of that injury gets cut off. So these injuries are generally classified as either complete or incomplete. A complete injury means that highway is completely severed. No signals are getting through at all. This is incredibly serious, especially the higher up it is. For instance, an injury above the C4 vertebra, that's pretty high up in the neck, can completely shut down the muscles you need to breathe. Now, with an incomplete injury, it's like a few lanes on that highway are still open. Some signals for movement or feeling can still sneak past the damage. Okay, another huge crisis for the nervous system is a stroke. It's basically a brain attack. And there's this really powerful acronym to help you spot one. B FAST. It's for B, balance, E, eyes, F, face, arms, and speech. But honestly, the most important letter here is T. T is for time, because with a stroke, every single second is critical. Getting help immediately is the one thing that can make all the difference. The most common kind of stroke is an ischemic stroke. All that means is there's a blockage, usually a blood clot, that's cutting off blood flow to a part of the brain. The good news? There's a really powerful clot-busting drug called RTPA that can just dissolve it. But here's the catch. It is a frantic race against the clock. That drug only works if it's given within a really tight window of time after the stroke starts. All right, so we've talked about what happens when the body takes a hit from the outside. Now let's shift gears and look at problems that start from within. What happens when pressure starts building inside the skull, or when diseases start messing with the body's signals right at the source? So your skull is basically a sealed, bony box. Inside you've got your brain, blood, and some fluid. And the pressure inside this box, we call it intracranial pressure, or ICP, is normally super low, somewhere between 10 and 15. But if that pressure starts to creep up past 20, it becomes a massive medical emergency. There's just no extra room in there, so the brain itself starts to get crushed. And when that pressure gets way too high, the body sends out this desperate last-ditch alarm signal. It's called Cushing's triad. And this isn't just a warning sign. It's a sign that the brain is literally about to be pushed out of its proper space. That event is called herniation, and it's often fatal. And this is where things get really weird. As that intense pressure starts to squeeze the brainstem, the part that controls all our basic functions, you see these three signs that just don't make sense together. The heart rate and breathing both slow way down, but blood pressure skyrockets. It's the body's final panicked attempt to force blood into a brain that's being squeezed shut. But pressure isn't the only threat from the inside. What if the damage is actually coming from your own body? Well, that's exactly what happens in multiple sclerosis. In MS, the body's own immune system gets confused and starts attacking the myelin sheath. That's the protective coating around your nerves. It's like the plastic insulation being stripped off an electrical wire, causing all those vital signals to get scrambled and short-circuit. Okay, we've spent a lot of time on the body's electrical grid. Now, let's switch over to that other system, the chemical messaging network, the endocrine system. This system is all about hormones. And when that delicate hormonal balance gets thrown way off, the whole body feels it. When you start looking at endocrine emergencies, you'll see this theme pop up again and again. It's all about balance. The problem is almost always a story of extremes. The body is either making way too much of a hormone or way too little. It's a flood or a drought. and both lead to these dramatic, often opposite effects. This is a perfect example of that. It's all about how the body manages water. Both of these conditions are about the same hormone, antidiuretic hormone, or ADH. An antidiuretic just tells your kidneys to hold on to water. So with diabetes insipidus, you have too little ADH and the kidneys just dump fluids like crazy. But in SIADH, you've got too much ADH, so the body holds on to every last drop, which dangerously waters down the sodium levels in your blood. And we see this exact same story of extremes with cortisol, the body's main stress hormone. Not enough cortisol gives you Addison's disease, which causes weakness and this strange darkening of the skin. But on the other hand, too much cortisol leads to Cushing's disease, and this causes really dramatic changes in the body, like the classic moon face and buffalo hump. Two totally opposite problems, all depending on the level of just one hormone. So we've seen how badly things can go wrong. To wrap things up, let's focus on a couple of critical alarm bells and the immediate actions they require. This is all about recognizing the signs and knowing exactly what to do in that moment. Okay, for patients with a high-level spinal cord injury, there's this condition called autonomic dysreflexia that is a huge threat. Basically, a simple irritation that they can't even feel, like a wrinkled sheet or a full bladder, triggers this massive out-of-control nervous system reflex. The system below the injury just goes haywire and causes their blood pressure to shoot up to terrifying levels. Now, the response to this is actually incredibly simple, but it has to be instant. The very first thing you do is sit the person up. Just by raising their head, you're using gravity to help drop their blood pressure. After you've done that, then you start hunting for what caused it in the first place. It's a great reminder that sometimes the most powerful interventions are also the simplest. Whether it's the bizarre alarm bells of Cushing's triad or a hormone imbalance that literally changes the shape of someone's face, our bodies are constantly communicating. These crises really pull back the curtain on that delicate dance between electricity and chemistry that keeps us all going. They show us that our bodies are always sending out signals, especially when things get tough. The real question is, are we listening?